ultrasound is basically, it's a non-invasive thing to use. We can use it repeatedly if we want to. Like if we want to scan something, if you have to take a patient for a CT scan, moving a patient from an ICU to scanner is not a very easy thing. And if you need to repeatedly see something, I think ultrasound is a better modality for that. And I think it gives us a more accurate picture.
It's a readily available bedside test. For me, the ultrasound becomes very useful at the bedside for things like pneumonias. I want to know a child is breathing very heavily. So I need to know whether it's because of just the pneumonia, or is there water filled up in the lungs, or if there's water around the lungs. Now all of these can be easily told to me by an ultrasound. So for the heart, it's extremely useful. So when we have a child with a low blood pressure, I need to monitor. I can't, an X-ray won't give me much of an idea. So looking at the heart pumping, I can do that with an ultrasound at the bedside.
The ultrasound has given us a completely different outlook in terms of doing many procedures that initially we were doing just blindly. For example, nerve blocks and vascular access was something that we used to do by blindly and by landmark technique and by experience as well. But now with the ultrasound, we have something which gives us a sort of an eye for us to manage those procedures while looking at them. Plus it is real time as well, so we can do it as the procedure is being done.
Right now I'm using the Sonosite, the machine. I am using it for many things. I also look at if there is brain swelling. I look at the pressure that I can see inside the eye. It can be used to also see whether when we put a tube for a ventilator, whether the tube is in the right position. Then coming to the chest, like I mentioned, any fluid leak, air leak around the lungs, a pneumonia, water filled in the lungs, all these we can figure out at the lung level, which we do routinely.
We are using Sonosite in our hospital as well, and we are using practically for most of our ICU procedures. I mean, line insertions and tracheostomies and tapping, name it, the procedure in ICU, we are doing ultrasound guided because it is helping us to have a more accurate picture, lesser chances of defaulting, lesser chances of complication, and easy to handle.
Machines that we're using are from Sonosite. One is the Sonosite S Nerve and one is the Sonosite Edge 2.
We've had a child very recently only who came to us with a cancer. Now this kid had a blood cancer, and secondary to that, the child had developed an infection. And the child actually, by all the numbers, were showing us infection. We were treating it, but the blood pressure was actually showing us a normal value when we checked the normal BP. So we then did an ultrasound, and actually we found that the child's veins were all collapsed, and what he needed was a lot of IV fluids. So a lot of IV fluids were started for this child, and actually this child was revived with just giving the fluids and the right antibiotics. So that was like an instant one.
We had a very sick patient in the ICU who was on a multi-organ support system, was getting better, and again had a turn in his clinical condition, and it was not possible to shift that patient for a CT scanner. So we did an ultrasound at the bedside, and we found where the patient was actually bleeding from, and the bedside we could help the patient to recover from that situation. So I think it is a single examination gave us an answer to a lot of questions that we had in our mind.
I guess the point of care ultrasound from anesthesia point of view can be applied from head to toe, really. Well, there are lots of instances where I have point of care ultrasound in my practice has helped. The most recent being the ultrasound of the gastric antrum, where one patient was posted for an emergency, a relatively emergency procedure, and there was a starvation issue, and we were not very sure about how long the patient has been starving from. So an ultrasound of the gastric antrum proved that the patient was starving, so we could do the procedure much earlier rather than have to wait for a few other tests to be done.
I spent a lot of time studying and writing chapters on subjects related to low blood pressure due to different conditions in children. We call that shock. So a lot of my body of work is in that. The chapters that I've written, the articles I've presented abroad and in India. So now I had one of my students who actually we've completed that study where we put these catheters into babies' umbilicus when they are born, when they are very sick. And so we got a comparison between an X-ray and ultrasound, whether we were missing out. We always do an X-ray to confirm the position. So we did a study to see by ultrasound whether we were missing out any of those right positioning of the lines. And we found that we were actually not missing anything. So an ultrasound is good enough. Now the next plan I have is, actually we are already doing it, is doing the chest ultrasound for little babies in the neonatal unit. We have new students every year, so we give them different projects. So that's the plan for this year.
My institute, we have a DNB teaching program where we have students coming to complete their post-graduation in anesthesia. So that involves a lot of work in terms of peripheral nerve blocks and central venous access, arterial access, and now a point of care ultrasound as well. So all of them are going through the teaching programs related to all these subjects. Plus, in addition to teaching programs, they use it in their day-to-day practice as well. So that also becomes a hands-on training process for them.
In children, in COVID-19, in children, they mostly get away with just getting a cold and a cough and a mild fever. But then there are some children who, after 3 to 4 weeks of getting COVID, develop something called as a Kawasaki-like syndrome. It's a fever with a rash, and the child can have development of a heart dysfunction in that. And in that, we need to do serial ultrasounds of the heart. So it's extremely important to monitor it every day because the arteries that supply the heart get swollen in this. Second is that when we get children with a pneumonia with COVID, so again we can use that to look at the lung shadows to see what's happening at the lung level. So it will help in that as well.
We have had lots of patients that are COVID positive and we couldn't wait longer to do surgical procedures. So a lot of the surgeries were done whenever possible under regional anesthetic techniques. So the ultrasound has helped us immensely in avoiding general anesthesia and any airway manipulations in COVID positive. So ultrasound has helped us identify correct placement of the endotracheal tubes by ultrasound of the upper airway as well as the ultrasound of the lungs. But ultrasound has been a major help in doing all these things.